Healthcare is continuously improving, but today's healthcare also faces great financing challenges due to demographic changes and several effective but costly medical innovations. This leads to costs rising at a faster pace than financing. An increasingly large funding gap is being created in healthcare. For more than 20 years, a solution for this has been to reduce the cost per activity in healthcare provision. For example, the cost of an appointment or surgery. The problem is the limited focus on what really matters. How well do patients become after their treatment, and what is the total cost of the care provided? Today's healthcare is evaluated by each individual activity instead of looking at the whole. GHP wants to change this. To show how we can make healthcare delivery more efficient while retaining quality, reducing the total time from symptoms to the completion of treatment, and at a lower cost, we can look at an example of a patient called Frederick. Frederick has a problem with his shoulder and has health insurance. We provide two examples to describe how Frederick can be treated. In the first example, we describe the traditional approach, followed by how we work differently at GHP Warzenwerken. First, let's have a look at the traditional way. Frederick calls his insurance company, where he speaks with a nurse who is responsible for making appointments. She listens to his description of his problem. As Frederick's shoulder is causing him a lot of issues, he is given an appointment with an orthopedic surgeon. The orthopedic surgeon spends a lot of time asking Frederick questions so that he can form an opinion. He then sends Frederick for an MRI, which is one of the most expensive types of examinations, but this does not concern the orthopedic surgeon, as he is evaluated on the basis of how much the appointment with him costs, not on the cost of the external diagnostic appointment. Frederick receives a new appointment with the orthopedic surgeon, where he is informed that the MRI did not show any serious injury and that physiotherapy can make him better. Frederick is then referred to the physiotherapist. At the physiotherapist, Frederick is shown his training program. The physiotherapist must constrain the time per appointment to be able to maintain a low cost per appointment, which is the measure by which he is evaluated. This means that there are 7 appointments in all with the physiotherapist before Frederick's treatment is complete. We will now look at how Frederick would have been treated at GHP Warzenwerken. When seeking care for his painful shoulder at GHP Warzenwerken, he describes his problem by means of an intelligent digital questionnaire. Based on the questionnaire, GHP makes sure that the patient meets the right specialist straight away. In this case, the injury is of such a nature that it's necessary for an orthopedic surgeon specialized in shoulder-related complications to assess the patient, and it can also be immediately concluded that further diagnostics will be needed. A physical doctor's appointment is made where the orthopedic surgeon carries out an ultrasound examination of the painful shoulder straight away. The doctor assesses that physiotherapy is necessary and therefore asks a physiotherapist to be in attendance at the end of the appointment. Frederick is also given future appointments for physiotherapy straight away. The physiotherapist knows that the aim is for Frederick to get as well as soon as possible in the most efficient way. Frederick is therefore given an appointment where he receives proper training and an app with films clearly showing all the exercises so that he can train on his own. As Frederick can train on his own at times convenient to him, only 3 slightly longer appointments are necessary with the physiotherapist before his shoulder feels better. When Frederick's treatment is complete, he is provided with a questionnaire to fill in to make sure that he really has been helped with his issues. Working in new ways can make healthcare considerably more efficient, but at the same time it is necessary to focus on the patient's entire journey through his treatment, and not just on the individual parts. The model that GHP employs at Warzenwerken will never win in a traditional tender process, as every single action taken is more expensive in this way of working. New types of collaboration between healthcare providers and financiers are therefore needed to be able to achieve better and more efficient care. These are the kind of collaborations that we are developing at GHP Warzenwerken in order to be able to offer better and more efficient healthcare.